And so while we wait for all of your scribbles, I have to say thank you, Sian. I feel like we spent the weekend together because I listened to a number of your podcasts and they were fantastic. So please, 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 it's a really nice companion for when you're chopping vegetables, not bone marrow. But it's a really great series that you've put together, and thank you so much for what you and Sammy have done for all of us. And in one of those sessions, just to lead off with a question, you talk about, it was Sick Kids Dr. Shandy, I believe, who talked about the change in language, because talking about death isn't fun and it's not natural in our society. But she said, rather than asking obtuse questions like, how are you? Or what do you need? She talked about the 3 W's. Can you say a bit more about wonder, worries, and wishes?
Wonder, worries, wishes. Is that something you use? Yeah, I wish, I worry, I wonder, but what, you want to take this? I have the great, it's a funny thing when we started our podcast because we just wanted, to learn from other people. And so you're asking me a question about what Shandy Alexander, she's a child life specialist at Sick Kids. And I don't remember what she said. It's a long time ago. But I know the I wish, I worry, I wonder framework, but I'm going to look to Tracy. Maybe you can help me out here.
Well, and that's quite a common way that we pose questions or ask, what somebody would like. I wish for you the very longest life that you can have possible, that you can have those important moments with your family. One of the things I'm worried about, however, is if, something happens, would your family know what your wishes are? And so it's a good way to start conversations where we are all hoping the very best. And so you talk about walking those 2 paths. So this is kind of how we start that conversation about those 2 paths is, I wish to be, on the highway to Edmonton. I wish that I'm on, the Trans-Canada. But in case I get in the ditch, how do I get out of the ditch, and where would you like me to go from there? So it's a way that we speak and we pose questions so that we can find out what somebody's wishes are.
Awesome. Okay, one from the audience. Many patients find, as their illness progresses, their doctors pull away, less communicative and seemingly less caring. What can patients and families do to help these docs open up?
I mean, I'm looking to my colleagues, but we talk a lot about it in the book and the workbook, but you just call it out. I mean, this is where, in a way, if the more activated that you are as a patient or family, you can, in a way, you have to train the doctors. You have permission to do that. You can role model the way that you want your care to be. Clinician, it looks like you might be uncomfortable with talking about how my illness might progress, but I'm not. I actually want to know what you think might happen, or what, and I'm not going to hold you to a time or whatever, but it's important to me. I'm the kind of person who likes to talk of things straight up, not sugar-coated, because that information is helpful to my family. So don't be afraid. I give you permission. You can say that, and that will help them because they don't know you as well as they know you know yourself.
It's a really good point. I happen to know a few physicians, and I know physicians can be as uncomfortable as we are with the word palliative and having these conversations. So don't, as you say, Diane, don't be afraid to bring it up, because they do want to talk about it with you.
And I often say that tears are just evidence of time well spent. Don't be afraid of the emotion. Don't be afraid of tears. We can speak through our tears and we can continue conversation. I often say if my kids aren't crying, that I'm going to pinch them because I want them to cry. I want to know that we had good life together. I want to know that we spent wonderful times together. I want to know that they love me as much as I love them. And with I thought I got cut off there for a second. And with our physicians and our care teams as well, we get to know our patients so well that sometimes it is hard as well to have those in-depth conversations because we're scared of evoking emotion. But the more comfortable we get with emotion, with the emotions that these challenging illnesses provide, the more we can have open and honest conversations.
Fantastic. I'm going to merge together about 3 questions here, so bear with me. but a lot of it focuses on access and what to do on the Sunshine Coast, given that over 6,000 people don't have a primary care doctor, or that there are a number of folks demanding care from the system. So what to do when there are so very few walk-in clinic hours, or people do not have a primary health care provider, where to go for support on that early intervention. Sorry to ask a tough one, but came from the audience.
I think that it's really important that as we start to age, that we start to think of these inevitabilities that we're going to need primary care providers. I was speaking with Shari about people who want to come to the Sunshine Coast, and this is one of the big worries, is who will provide your health care. So if you have a physician who is off coast, hold on to that physician. We need to maximize our physicians and maximize, if we're who we're using and their client load, so that they can provide care to everybody.
Yeah, I knew this question would come up, and I wish I could provide a quick response and be able to tell you that everyone will have a physician. Now, I am the manager of the primary care network, and we are doing our best to be able to add nurses, nurse practitioners, and also to be able to recruit more physicians to the Sunshine Coast. And I'm told that we're making, with physicians are coming. I've heard all sorts of rumors. Somebody told me this morning they'd heard a rumor that there was a whole bunch coming, so I don't know. I hope that's true. But we are doing our best to support everyone through our services at VCH.
Yeah, and maybe because obviously I don't live here, and it's very real, access to healthcare. It's so important, and the video of the amazing services at the hospital. But I just want to remind ourselves that 95% of the care is being provided by our community and by our families. This is a shout out to the Sunshine Coast Hospice and the volunteer programs that they have. Before we had all those machines, community cared for its people. So a lot of the things that you might need, like how you activate your village and this emotional support and the practical support, there are people in your community right now who have information and knowledge and support that can help you. And so I think, yes, we obviously want the best medical care, and there's clinical skills that are important, but 95% of what Sammy does is informational. It's not the symptom management, morphine prescribing. So having that, where you can seek that information can be found. So, we're not entirely powerless. It doesn't solve the problem, obviously. But I don't want people to think that because they don't have a doctor, they can't get anything. That's the farthest thing from the truth.
That leads really nicely to this question. How can friends and neighbors best offer support when it hasn't been asked for? Do you have some stories on how to illustrate this to help activate that village?
Oh gosh, that's a good question. We talk about this in our workbook, I think. In our book, I think actually that exercise, we talk about the kinds of supports that they need. Maybe I'll just build on the question. It's sort of like, if they're not talking about it, how can I be supportive? And I think in the same way that if you're the patient and you're role modeling to the healthcare providers of how you want to walk two roads, you can do that as a friend. I'm here to listen. I'm here to walk two roads if you want. Are you the kind of person who wants to walk two roads? Or, what is it that you need from me? Because I'm here to also, just be. I don't always have to be the person to talk about the good stuff or I can also be the person to just listen. What is it that, I think I've heard what is it that you need, or what's on your mind? What's on your mind? Open-ended question, and they will just talk. And maybe they have nothing to say, and that's okay. My dad's a man of few words. We don't talk, but just being together is his way of spending quality time. So I think through your actions, you can ask permission to support. And I think the other thing that I've learned is don't ask what can I do, because people don't want to feel like they're asking for help. So if you're a great cook, you can offer and say, hey, I am going to take this on for you. I'm going to make casseroles for you on Mondays, or I'm going to walk your dog on Tuesdays and Thursdays. Or I can just be with you. Which one do you want? But don't ask an open-ended question of what can I do, because they will say nothing.
Well, and then it's one more task. If you're saying, what can I do for you, or call me when you need something, then that's one more task that somebody has to do. So instead, I'm going to, do your yard work on Tuesday, or, real tangible things that you can do for somebody, because you're right, it is hard for people to ask for that help, not only because it's hard to ask for help, but also because it's hard to admit you need help.
How early should you talk to palliative care, and is there another phrase or name for palliative? It's a twofer.
So as that one video demonstrated, I don't think we have to be afraid of the words palliative, of the words death, of the words dying. We are taught in palliative to use these real words because sometimes there can be a translation error. Sometimes, I had this one friend, he was Russian. He told me that on the weekend he passed away. He meant he passed out. So, if we tend to use euphemisms because we are afraid to use the real words. We think it'll soften the message. But the message is still the same, so let's use the real words. We are trying to show people that palliative care can start right at the beginning of a life-changing illness. It can start right at the beginning because palliative care is about symptom management. It is about identifying what your needs, wishes, and wants are. Who would not want a care team who wants to talk to you about your needs, wishes, and wants? We always want someone to ask us what we need, what we want. So let's start doing that and get comfortable with palliative. Let's get comfortable that there's going to be a whole team of professionals who are going to be waiting to develop this roadmap with me so that we can move together, so we're not in the middle of lanes, we're not in the middle of roads. We can have two separate roads, but still be going forward.
Can I just say one thing? So I'm a card-carrying palliative care member. I'm a palliative care research chair. And yes to all of that. But you may find that there's not enough Tracys in the world. So if you all ask for palliative care, they're going to say, well, Tracy's very busy. She has to see the sickest people. So there are some system barriers. So I will just say that it's a palliative approach to care that can have a benefit. But the 7 keys are the way that you can leach out that approach without the labels. So the essence of palliative care is those 7 keys, in my opinion. It is about, and you can lead it, and of course, if you can access it, ask for it. The hospice volunteers are doing it. The healthcare providers are doing it. So you don't only need to get palliative approach from a palliative care specialist. That's all I just wanted to say.
Great, thank you so much. Just to make things spicy, there is a question about the role of touch and snuggling with partners when they're going through a palliative journey, otherwise known as sex, or just snuggling. So could you talk a bit more about the importance of that role and or practice as people are going through their journeys?
Intimacy is very important, no matter how you are intimate. Some of us can be intimate, holding hands, touching, sharing our deepest thoughts and feelings. Intimacy, there's a lot of different ways, but depending where you are in your illness or where you are age-wise, some people value or need that physical relationship. And that's great. Have open and honest conversations about it. Talk with your partner about what type of intimacy you're requiring. And that doesn't mean sex has to be off the table. It's or
on the table. Whoops. Whoops.
It can be on the table too. But these are, I didn't see it, but I guess I did. But these are important conversations that we need to have, and have them with the people that you love. I told my daughters when they were embarking on relationships of their own that if you're too scared to be talking about it, then you can't be doing it. So just talk about it. Talk about, what you need from your partner. What makes you feel loved? What makes you feel loved? Love is it's a basic need. What makes you feel loved?
I think it's worth mentioning at Mossy Rock, the beds that we have chosen They all expand, I believe, to double? No, those, okay, we have,
But they are low so that partners and friends and spouses can lie next.
can lie next to them. Okay. Because we talked about cuddle beds. That's right, okay.
No water beds, right? Fantastic. There's a question just openly asking about volunteer opportunities, and we've touched upon a variety of organizations, but Shari, in your role as the head of home care services, can you speak to the different ways if people want to volunteer and help and be useful, what they could possibly do and where they should go for more information?
Thank you for that question. We need volunteers. There's so many opportunities on the Sunshine Coast to volunteer. Through home care, we have several programs. One of our programs is Meals on Wheels, and our volunteers deliver the meals up the Sunshine Coast several times a week. Most of our volunteers are seniors themselves. They go away in the winter. Weather is bad. We certainly don't expect them to be out in the weather. This is one of our most urgent needs. We also have our volunteer drivers. These drivers will take clients not only to medical appointments on the Sunshine Coast, but more importantly to Vancouver, which is a full day for these volunteers. And we're fortunate to have, I think we have 2 volunteers at the moment that do this. We also have the telephone tree program, which is a little bit easier to manage because it's checking on clients through phone visits. And then there's just so many other opportunities through our not-for-profits.
Okay, thank you. A question about palliative care for dementia patients. When would palliative care get involved, and what kind of support is currently available for caregivers? Because it seems to be waiting lists for everything.
I think so. Oftentimes when we're talking about, you've probably heard of something called a palliative performance scale. So we look at what illness somebody has, and we look at what the common trajectory is. We find that somebody with dementia will go along this way for a very long time. So it can be very difficult to prognosticate or to be able to suss out what the trajectory might be. Now that's not helpful to family members, because family members, this could be a very long haul journey. You know, this isn't a 3-month journey or a 6-month journey. This is a journey for a long time. It could be years, and this can be very challenging when you're the one at home who's providing that care. So I think what we try and look at is, what symptoms do we want to manage? Is it that the person, the caregiver at home needs a break? Do we need respite care? Do we need to have a case manager involved, which is when we have clients whose trajectory isn't less than a year? Do we get a case manager involved who can talk about different programs that a person with dementia can attend? And yes, there are wait lists, and as there are with most things on the Sunshine Coast, one of the important things is to be having that bigger picture thinking, is looking and anticipating what you're going to need down the road so that we can get on those wait lists. Because if I try and book a plane, if I want to take a holiday to Jamaica tomorrow, it's going to be very difficult for me to get the right flight that I want to take. But if I plan 6 months ahead, I'll have greater success of getting that flight.
And I also urge you to connect with our older adult mental health team who are here today. Kelsey and Angelina are in the foyer. And this program is specifically for supporting caregivers and their loved one in the dementia journey.
And the hospice, right? The hospice has a day program which patients such as with dementia and their caregivers go to. It's a very popular and successful program. So I think there's quite a few things. And it's all about asking around, connecting the dots, and learning the system, yeah.
So if there's anyone in this audience that wants to volunteer, whether it's through hospice, the auxiliary, some of the home care programs that Shari just mentioned, please, please, please connect with folks in the lobby after today's session. Few questions about the VCH home care team, and are they able to meet the level of needs for patients and their families?
Not sure.
Maybe people don't know much about how big is that team, Shari, and,
Oh, how
and
big
what
is
do
the
they
team?
do?
Wow, we're a big team. I know it gets a bit confusing when we talk about home support versus home health. So when we speak about home support primarily is a group of care aides, of community health workers who come to your home to provide activities of daily living. So they're helping you with your shower, getting dressed, meals, medications. And on that team, you would have LPNs overseeing it, and Vanessa is here as well. She's the educator. So that's sort of the home support piece. And then you jump over to the home health side. And home health is the home care nurses. It's our social worker, dietitian, occupational therapist, physiotherapist. Who else? Help me, I always forget someone. Our team's so big.
Like occupational therapists, dietitians.
Pretty much every.
Yeah, I think you got
And
that.
case managers, of
Yes.
course. The case managers are sort of at the center. Those are the people, the nurses you would probably contact first to be able to organize all of these services, if that answers the question.
That's great. There's actually a handout out there from the Medtalk that we did with you, Shari, and it's the numbers to call and all the different roles of the various providers in home care. So there's a question here on, would you encourage a death cafe in our community? Could you tell me what that is? And since giving anyone an opportunity to openly talk about the end of life, is that something that you would encourage, or is that something that's currently available through hospice?
I don't know.
I have no idea.
No
A death
idea.
cafe is also an international movement where people come together. I don't think they necessarily have an agenda, but people can talk, bring questions about dying, death, or anything, and the people there who host it will just foster a conversation about it. I've heard death over drinks. I've heard, death cafes. I think it's just making it, normalizing it. And I think that this is a question for the community. If the community wants it, they should have it. Or if somebody wants to lead it, they should. I mean, that is the point of it, is that if this is somebody's thing or their jam, they should see if others and come together. Why would, it's a great thing. But it's not the one silver bullet solution, but it's a great idea to normalize it, have people discuss it, along with many other things.
Great. We have a few here that are a bit pointed at doctors and some frustration, but what we're going to do is bend it forward. What can the audience do if they find that one of their caregivers isn't particularly helpful? Where do they turn for additional support, or how can they mitigate what they feel like is being dismissed?
Caregivers or the doctors?
Doctors.
Oh, so not like your husband and no, okay. They divorced, but okay. So you mean like your care support team? So I'm assuming that we're actually go ahead.
Oh, no. I mean, I think they're trying to say if they feel like their healthcare providers are not listening or not helpful or dismissing them, et cetera, right? So, I mean, we have a lot of, that's the Invite Yourself chapter where we talk about, here are tips that you can do to be respectfully assertive. Not aggressive and not passive, but respectfully assertive. And the two biggest tips that I can give you is, one is if you tell them the why. So I have these questions, but it's really important because I have a lot of, I'm really worried, or I'm the kind of person who really likes to know, and this is going to help me be able to feel less anxious, and it really will help my family because we're planning all these things. That's why I'm asking these questions. Giving them the why will give them some contact, and you're pulling on their heartstrings because somewhere in there is a human being. They're trying to, they've lost some of that. The system is wiped out. And the second tip I've really learned is compliment them. You're like, oh, you're so great. I'm so lucky to have you. I've heard you've been such a, I'm telling you, ego is like, And then you say, no, this is the tips that I've learned. And they say, I've heard, you're this cardiologist, you must have seen thousands of patients just like me. And so, when you say you don't know what's going to happen next, it's, what I'm really asking is the big picture, because you must know, you're such an expert, blah, blah, blah. I made a joke once about how nice they look, and then someone said, you're not supposed to comment on their looks, so maybe don't do that. But comment on their brain, maybe. They'll be like, oh. But I think it's, giving them all the good, and then you put in this is what I need from you. And then suddenly they're like, I should answer that because they look at me and respect me. So those are the 2 tips I've learned from a lot of patients out there.
Yeah, that's great.
Right on.
Yeah, I love it.
If they said you have such a nice full head of hair, I'd be like, oh, now I know you're lying, right? Trying to butter me up.
That's great advice. I mean, we have complaint lines and we have formal complaint processes, but communication is always the best.
But I think there is frustration, and I think everyone they're probably clients and family members too. It's the system is broken. I think we just want to have some empathy for that. They're working in a broken system too. So if we come to healthcare providers and recognize that, I know you're really busy. I bet we do that already. Like, we know you're really busy. We want to be respectful, but I really have this burning question. And so before we leave here today, I really have 2 questions that I really want to get to. And you can look at them and see, but it's really important that I get to, because I've been waiting a long time. Just because if we go out there and let it all out, they're going to be defensive. So that recognizing that they're human too in there, putting the human back, and I think that goes a long way, because they're running around. They're very busy. They've got so many things on the plate. They're not trying to be late. They really are trying to do their best, but we get it. It's not perfect. So I think trying to find how we can work together is way. And the more activated and informed you are, the more likely they're going to be like, yeah, okay, I'm going to take the time and sit and answer this. And you can always say things like, maybe this is too big a question for this visit, but can we please book another visit the next time and talk about this specifically because it's so important. That's being respectful, right? Maybe you can't do this now, but this is really important, blah, blah, blah. So anyway.
Like it.
Right on. Along those lines, as far as how to effectively communicate and even effectively disagree, can you talk about some of the pros and cons of when a patient decides to go off chemotherapy, and what to do and how to ensure those wishes are communicated?
Oh, that sounds like a Tracy question.
From the way the question is posed, it seems that maybe perhaps somebody is choosing not to have chemotherapy when perhaps it was recommended. But I think that one of the things that's really important to remember is that all healthcare providers recognize that our patients and their families are in the driver's seat, and we are along for the journey in the passenger seat. We aren't driving the car. We are next to you and asking you questions so that you can get to your destination. And so if somebody is choosing not to have chemotherapy, we support our clients' choices because they aren't our choices, they are yours. We support you in your care plan, and we help you to manage the choices that you are making and then what comes as a result of those choices. Now, obviously, when somebody's choosing to quit chemotherapy or to change a treatment plan, it then has a result or repercussion sounds a little too harsh, but it has then things that occur, and your physician and your care team will tell you what to expect then after you stop chemo. But a lot of people will opt to not have chemo because they either they don't like the side effects of the chemo, or perhaps they are willing to accept their fate as it is. And there is honor in that as well, and we are here to honor those choices.
Yeah, customize your orders about, and sometimes you might have to explain to your clinician, this is what's important to me, and this is why I'm choosing that. And even if you might not choose that, this is how this is the right path for me. I think the key is that we want to make sure you're fully informed, so you're not making decisions about your care with with wrong information. But if you're fully informed and sharing what's important to you and your values, and if they understand your priorities and values, they might understand, and your family or whatever might understand why you've come that way. And that might actually heal some of the tensions that happen when many people want different things.
Right. Can you tell us more about the new Sunshine Coast ambassadors, and how do they help individuals and families?
Oh, I think the ambassadors are what we, in the Waiting Revolution, we've, to have this global social movement, we have put our workbook, we've created a course with it and materials that anyone can become an ambassador, which maybe is confusing. Sammy's like, you should have called it facilitator. And I'm like, it's too late. We already put it on the website. But anyway, really are just facilitators of the education. So I think they're just people who have read the book or have the workbook in their hands, I know there are volunteers in the audience, and who can, maybe they'll have classes or they'll do one-on-one, but it's just ways to get information. But it's not only about the keys, right? There's lots of amazing programs, like they have grief programs and various different things. So I think the ambassadors are just a way to embody these keys so that it's early and not waiting till the last days and weeks that you're connected with some of the resources all throughout this community.
Fantastic. We could go on for hours, but I won't torture you guys much longer. Can you talk about the possibility of recording a diagnosis or recording some of those patient-doctor situations, and what the benefit of recording that situation would be for the extended community of supporters?
I'm not sure what you mean. Are you asking that when they're receiving information that they record it?
Yeah, just because there's a lot about being overwhelmed in the moment of getting that news, and is it allowed?
You have to ask permission at any time. Whenever you want to record a conversation, whether or not you are in your physician's office or if you're in a home care setting, you do need to ask permission to record the person that is there with you. I think that in speaking about your village, a healthcare advocate is really important to bring with you, somebody to bring with you when you are receiving this information, so that they can write it down for you, or they can ask questions that you may not be able to think of.
No, my light came on. I think I would just say, I've heard permission, but if you tell them the why, again, why are you asking that? Oh, because I'm hard of hearing, or there's a lot of information, and my daughter who, lives blah, 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 is going to want to ask me these questions, and I don't want to have to tell her everything. So would it be okay? I can listen to it again and help me understand all these reasons. I think many healthcare providers will be more open to that. I think they're more worried that you're going to sue them because so-and-so said this and that, that kind of thing. So if that's not your relationship, then they don't have as much to worry about. So that's all I would say, yeah.
Terrific. Thank you so much. Everyone, could we please give a round of applause to our speakers today?